All right. Good afternoon, or good morning, or good day, everybody. This is Rolando Mia with Zyris. I have a very special guest here and really excited to spend some time with Dr. Thomas Hirsch. Dr. Hirsch is the inventor of our system. He's also a principal and founder of the company. And he's here today. But the reason we have him on right now specifically is we wanted to bring him into kind of the dialogue that we're having around this and get his perspective. Because in addition to being one of our owners, he also has a full-time practice and practices full-time in Malibu. So the purpose of this is to talk about and get his advice and his insight into how we're dealing with this crisis as a dentist, as a practitioner. So thank you for joining us, Dr. Tom. It's a pleasure. Really look forward to talking.
Good morning, Rolando. How are you today?
I'm doing well. So
I'm honored that you was allow me to sit down there and voice my opinions to the live audience of dentists and anybody else that's looking in today.
Awesome.
It's going to be interesting.
It's going to be fun. Yeah. So when you look, we're in a crisis right now, and so many things are impacting, dentists specifically and the industry. How are you currently, navigating? What are you doing to get through this, and what advice would you give people starting out?
Rolando, it's a great question. What do we do in these uncharted waters? Nothing like this has ever happened. I've been practicing dentistry for almost 50 years now. Still a full-time practice in Malibu. I get up, I go to work every single day. I used to be a wet-fingered dentist. Now I'm a wet-gloved dentist. But I'm here in the office every 4 days a week, Monday, Tuesday, Wednesday, Thursday. We start at 7:30 in the morning. We finish up about 4:30 or 5 o'clock. Emergencies dependent. But what am I doing today in these uncharted waters? We're trying to be as safe as we possibly can in the office. Our office has always had a really high level of sterilization protocol. My staff is much better at it than I. I kind of dictated what we need to do, and they follow it. And when I break the rules, I get spanked. They'll go in there, they'll slap my hand so bad, say, "No, you didn't do that." Or if I'm leaving the room for some reason, I was in a hurry to go to the lab and I've got my glove on, they grab me by the scrubs, they pull me back in the room and say, glove. So the point of this whole thing is we as dentists and as dental personnel have to be over the top careful about what we're doing in sterilization protocols in our office. So we've stepped it up a lot.
So could you share with us some of the, so it's, yes, sterilization, PPE, all that type has been in dentistry for a while. But from your perspective, what have you done to not only, make sure it's in place, but enhance that? How do you treat, your emergency patients when they come in now?
So what we're doing right now, we are only seeing emergency patients in the office. True dental emergency. Somebody's in a massive amount of pain, or they've got an infection, or they've got some facial swelling that can go down to a cellulitis, into a Ludwig's angina. Anything that's that serious that we don't feel that it can be handled just by antibiotics alone, we're going to get them in the office and we're going to take care of their immediate problem. That's the first thing that we do. Routine dentistry for us has stopped. We don't have any hygiene patients. I'm not seeing any other patients on any procedure. So that's just kind of common sense mandated and dictated as far as what we need to do to keep ourselves safe. So that's the protocol in the office, is emergency patients only. Now, to answer directly your question, what are we doing? Well, besides our regular sterilization protocol, which really began back in the 80s when HIV and AIDS hit the scene. Before that, before 1980 or 1986, 87, we'd come into the operatory, we'd wash our hands. Most of the time I was working in a polo shirt and a pair of slacks. And that was my protocol in the office. I didn't have scrubs. I wasn't doing surgery, so I didn't feel that was necessary. But the moment that HIV hit the scenes, things changed. It was a paradigm shift in dentistry. It was a paradigm shift in sterilization protocol. For instance, before 1987, we didn't autoclave our handpieces, and everything that was being sucked up into the turbines, It was wiped down, but we didn't worry about it. And sure, there was the need for it at that time, but we, as a general dental population, not just myself, but as a general dental population, weren't doing everything that we needed to do. AIDS came along, we were gloved, hand pieces were autoclaved, and the sterilization protocol just went up to the next level. Well, it's happened again. This is somewhat 35 years later, 33, 34, 35 years later. Once again, we have to up our game. The common everyday sterilization protocol isn't good enough anymore. So here's what we do. If a patient calls up and they have an emergency, my receptionist will instruct them as far as what they're going to do to be allowed to come into the office. First of all, she'll do a brief history over the phone, brief medical history. She will then, when they come in there, tell the patients they're not allowed in our office until the other patient is gone. If we happen to have another patient, we see one patient at a time. They are to wait in their car or in their transportation mode or outside the building or wherever they happen to be until we call them to come up. When they come down, my assistant will go down, take them the health histories and stuff to fill out. She'll also hand them a pair of gloves, and she'll also hand them a mask. So when they come into our office, when we're ready for them and everything is ready to go, they're gloved, they're masked, they're not seated in the reception room, they're taken immediately into the operatory. They've been instructed not to touch anything in the office, not a counter surface or anything. So that's the first thing that we do when somebody comes in. The second thing that we do, besides our normal everyday protocol of wiping everything down, surface disinfectants, that's really kind of gone over the top. We wipe it down once, we wipe it down twice, we wipe it down 3 times. My assistants are just over the top on that. A patient leaves the operatory, it's wiped down. It's wiped down a second time after the patient leaves the operatory, and then immediately before the other patient comes in, the new patient comes in, it's wiped down a third time. So that's the second thing that we do. Anything that I'm going to touch has a barrier on it. We used to go ahead, if we were going to go in and open up a drawer, we pick up a gauze square, we'd get the handle of the drawer and open it up that way. But now what we'll do is barriers are on everything. And the patients really appreciate that. Barriers on all of our hand pieces, sleeves, on our 3-way syringes, the surgical barriers on the light handles, anything that we can touch is covered. And above and beyond that, in the elevator, when our assistant goes down, I just thought about this, when our assistant goes down to the elevator to escort the patient up or have the patient come up, the buttons on the elevator are covered with a sticky barrier too. So is it over the top? No, it's not. It's safe. And that's what it is. And it's safety first. Safety for myself, safety for my staff, and safety for the patients. And the patients really appreciate the extra steps that we're taking. They feel comfortable to come into the office and to sit down, knowing that they're the only ones that are going to be seen.
You know, that's...
Did that answer your question?
Oh, absolutely. That's incredible. When you think about it, the just the scrutiny that you're putting in place to ensure that people, patients, staff, you are separate from that is huge. Also, I appreciate you clarifying that you, even though you are open, you only see emergency patients. What are some of the patients, what are some of the things that you've been seeing lately, and how are you handling those? What's the protocol on the treatment?
Oh, let me think about what happened last week. This is kind of a cute story. Last week, I had a fellow that came in on Thursday. He called up and he was just in a massive amount of pain and he was starting to swell. And so we got him in the office and we took a look at it. And it turned out that the situation was isolated to tooth number 18. He had called up because he said he was swollen. He had a lot of pain there. When he came in there, he walks in with this thing in his hand. I couldn't quite tell what it was. I couldn't tell it was gold. I couldn't tell what it was silver. Turned out it was an amalgam buildup, a 5-surface amalgam buildup on a root canal tooth on number 18 that he'd done in the service. And I looked at it and it had fallen out and it was all massively decaying there. So the tooth was beyond salvage. And there was a lot of suppurative drainage around that tooth. So we decided we were going to take that tooth out that day. And I was questioning him about his history and this and that. He said he had a lot of work done in the service. And so we talked a little bit about that. And you got to pay this thing forward from time to time. And so what we ended up doing is he was real concerned about the cost. And I said, well, you know what? This one's on me. You took care of our government. I'm going to take care of you. He's a Pepperdine student. He's 30X amount of years old. He's a Pepperdine student on the GI Bill of Health, going to school up there, and his tuition is being paid for by the government. So he doesn't have the extra money. So I looked at it, and we decided to take that tooth out. Got him, and we took it out, and we went the extra mile. You know, anybody can take a tooth out, leave a massive hole there. Someday, he may want to put an implant in there. So you know what? I grafted it. I put a membrane on it. I sutured it closed, and we set the foundation for what's going to happen in the future. You know, pay this thing forward a little bit. What did it cost me? A few bucks in supplies, some grafting material, and a membrane, and some sutures. Pay it forward. That's one thing that you can do. So we got the tooth taken out, and that's what we did that Thursday. He came in for a post-operative follow-up Monday. And so on Monday, he was here for a post-op follow-up. We looked at it just to see how the swelling was, how the infection control was going, and everything looked really fine and great. And I had taken a set of x-rays on him when he came in, and he's missing a lot of teeth. Missing number 7 right up there in the front. And I looked at this thing, and I thought, you know what? This guy's in the office. He's missing number 7. Well, that part of the procedure is an emergency procedure, but he's here anyway on a follow-up visit that we had to take care of. So I said, you know what? I'm really going to help you out here again. I said, once again, yeah, you served me. You served my country. You helped me. You made me safe. So I'm going to help you a little bit. While he was there, I said, you know what? We're going to make you a bridge. And so what I did is I have a CAD CAM situation, a prime scan from Sirona in my office. We scanned this thing, made him a no prep bridge. Oh, he was in a massive amount of crossbite like that. So class 3 occlusion. So we didn't have to do any preparation work at all. We just imaged this thing. I spent an hour and 15 minutes designing it, milling it, baking it, and custom staining in his mouth. And this guy walked out like he was so happy he couldn't even believe it. And I said, you know, I'm not even going to charge for this thing. You know, it's my time. God, I got plenty of time right now. So I said, I'm not even going to charge you for this. But then I started thinking as he's walking out of the office, I said, wait a minute. You know what? I take that back. I am going to charge you. Because really, people don't appreciate what they get for nothing. So you're going to give me $10. And if you can't pay that today, we'll let you come back. I said, no, I can take care of that. So
that's cool.
It made me feel good. It made him feel good. I'm sure it's going to boost his confidence way up over the top when he goes out and he starts interacting with people, because he was kind of shy, but you know, he walked with a smile on his face.
That is cool. Well, thank you for sharing. I mean, yeah, you're right. It's funny. Everyone is talking about doom and gloom, how things going to be closed forever and all that, and it's nice to hear a cool story like that. And yeah, you were there, and I'm sure he was thrilled about that. So thanks for sharing that. That's cool.
Oh, yeah. So let me give you another story. I'll think about in a second here. Being in the office, what are we doing to help survive? Being in the office, being available is so huge for your practice to get an emergency situation. I had another patient that called up with an endodontic problem, a lot of swelling. He said, no, I take that back. It was his son. It was his son that had a lot of pain. He'd been up for 3 nights and woke him up every night. The kid was 12 years old. And I said, well, how about your dentist? He said, well, I called my dentist. He says he's just, you know, he's not going to see me because it's not an emergency. It's not, in quote, a real emergency. And I said, well, you know, if your child's in pain, to me, in my evaluation, that's an emergency. No, he's not bleeding. No, he's not swollen, but he's in pain. So pain to me is an emergency. So I said, bring him in. Let's see what we can do about this. So he brought him in, and we looked at the tooth. Tooth number 12-year-old. Hey, it was 18 again. 218 same day. So it was tooth number 18 again. So we took an x-ray of it. He's a gagger. And this was after hours. This is on a Friday, which I'm not usually in the office on a Friday, but I saw him anyway. My staff wasn't even here. Come on in. I took an x-ray. I couldn't even get an x-ray of him very well. My assistant, I'm sure, would have done a much better job than I. But I looked at this thing, and it's right there next to the pulp. So I could go ahead. I could send him to the endodontist or clean it out, not knowing what we're going to do. So I started cleaning the tooth out, got him numb. I cleaned it out, went right down, right next to the pulp. Not an exposure, but I'm sure if we would have left this for another month, this would have turned into an endodontic problem, and the kid would have had a root canal, and the root canal would have led to a crown, and sooner or later, 30 years down the road, something's going to fail, and you probably lose that tooth. So what we can do, we have to use our common sense here. So I use my common sense and help them out. What's that going to do for me? You know what? I got a new family as patients. I got,
That's
4 of them. So they're going to be coming to me because I'm here, I'm available, I'm closer than their other dentist is. So being available is one of the ways that you're going to combat the coronavirus crisis.
That's so cool. Thanks for sharing that.
Mm-hmm.
How are you dealing with the fact that you've gone from treating so many patients to very, very few? And what about the financial impact to you as a practice? What advice would you give people who are, sitting there, the uncertainty of this and this overwhelming, pressure of, holy cow, I owe a lot of money. What advice would you give regarding that?
Don't hang yourself.
No.
No. It's tough out there. It really is. And so companies that we're working with, that we buy our supplies from, they're there to help you. For instance, Patterson, that's who I get all my supplies from. I just sent a notification out saying, hey, if you've got any loans that you want, you can put them on hold for 3 months. So right now, conserving cash is king. I've told my assistants, any orders that go out, I want to see them. I want to make sure they're absolutely mandatory. I don't want to be stocking up on things. I'm not worried about hoarding stuff. So I want to see every order before it goes out. So that's one of the things that they do. Was they'll come to me and say, we need this order, we need these. I said, well, what's our stock? What's our supply? Where are we on this? We'll postpone it or we'll let it go forward. So we try and conserve our cash that way. Another thing that I did, my staff may not like it all that much, is I said overtime is gone. There is no overtime anymore because my girls will usually be here, if I'm seeing a patient and I have to stay a little bit longer, they would stay, or both of them would stay, 2 or 3 would stay to check the patient. I said, no, that's done. So the overtime aspect of the practice is gone because I have to conserve cash. And back again to Patterson once again. So we're able to put on hold or apply to put on hold some of our equipment financing. So, I've got a lot of high tech equipment in my office with cone beams and pretty fancy Sirona chairs and the new Prime Scan and the milling machine. So I've got a lot of stuff with equipment loans. Patterson said, hey, you can put this thing on hold for 3 months. And I applied for that, just got a response back from Patterson that said, yeah, you're good until July. So April, May, and June, I don't have to make any payments. So that's going to give me a little cushion, a little bit extra that I can deal with. So a lot of your other suppliers will do the same thing.
So it's about reaching out and working with them. It sounds like
reach out with people.
Thank you for that.
Yeah.
How are you communicating, and what is the message that you're giving out to patients, and what is it that you want your patients to know beyond the fact that you're available? What are some of the other things that you're currently working through for that?
Boy, that's a great question, Ro. That's a really good question. So one of the things that we're doing is with our office software, we're able to text patients. When we elected or mandated to stop hygiene, to stop all dental appointments, we pushed those appointments out about 3 or 4 weeks. And now we've had to push them out again another 3 or 4 weeks. So we're staying in constant contact with our patients. And that's really important to do. We have to let them know what's going on here, how they're going to be safe. We let them know what our protocols are in the office to maintain that degree of sterility that we have to maintain, how we're above and beyond what might be required just for their own safety and their own benefit for us.
So it's constant communication. I like the fact that you, even though it sounds like you're uncertain when you can do this. You're just kind of putting a stake in the ground for when they can come back, and then if you need to, it sounds like it's just a matter of letting them know or rescheduling further down so that it maintains that connection.
Exactly. What you can't do is you can't wait for this thing to come over, or when you can't wait for the government to tell you, okay, you can go back to work now. You can't wait for that day and then open up your doors and expect the patients to flood into the office. You have to be proactive on this whole thing. You have to be reaching out to your patients, saying, look, we have this on hold right now. Are you ready to begin? For instance, just this morning, I had fortunately, there's a full mouth reconstruction waiting to start. But I can't, in all good faith, start it right now, even though she's got broken teeth and missing teeth and she looks pretty bad. She's ready to go. So what we've done is we've reached out to her, say, look, when we're open, and I don't know what date that's going to be, but let's suppose it's going to be here. Let's get you in right away so we can get started. So I haven't even begun that thing yet, other than we've done some diagnostics. I put together a treatment plan. I got some models. We've done a diagnostic wax-up of the case. She's ready to go and she's committed. So once we're able to start seeing patients, I'm ready to go. All this stuff that we have that we've been working on, put it on the books, get it there, and tell them, we're going to get you here and get you organized. If we have to move it, we will. And maybe allow yourselves a little longer time with your patients. Actually, you're going to need to allow yourself longer time with your patients, because you're going to be, your sterilization protocol is going to take longer, one patient in the office at a time. You're going to have to distance your patients in the reception room. The reception room stuff's gone out of the reception room. We had a coffee maker in the reception room. We had magazines in the reception room. Right. We don't have that anymore. We had a charging station in the reception room. Don't have that anymore. Things that are in common, it's a paradigm shift. It's just a paradigm shift as far as what we're going to have to do.
Yeah, I love the context that you built earlier in referencing HIV. It sounds like these crises or these things cycle. And what happens is it forces us as a community, as an industry, as a global community, to have to then revisit things that we thought we kind of took for granted. It's amazing, and to see how you're adjusting that, I think that's really, really, really powerful. From a team and from a staff perspective, how are you handling that? Is your entire staff still fully employed? Are they on furlough? How are you managing that right now?
That's a great question. That's a really good question that I don't have all the answers for, but let me tell you what we're doing, and what I'm doing may not even be right at this point in time. The staff has been reduced down to half of what it was. My hygienists are at this point furloughed. They actually voluntarily said, we're going to voluntarily not come into the office. I have a staff of 5. I've got 2 hygienists, 2 assistants, and 1 front desk person. I had 2 other front desk people that just over the course of time just kind of faded out. So we've been able to manage our office with the 5 people that we have now, with a little bit of crossover from front to back and back to front. So everybody's kind of cross-trained to take care of things. So what we're doing is my two assistants are on 50% reduction in hours. They're alternating weeks right now. My front desk person is there full time, and then what she'll do is we're thinking about having her on Fridays. Since I'm not even available on Fridays, she's taking and rolling over the phone communication, so everything goes to her, so she's in contact with patients. So any emergencies that come up over the weekend, she can get a hold of me. She can screen them and then get a hold of me and decide whether it's a true emergency or not. So we've cut down by about 50% on the staff. The other thing, there is a new package, or a new stimulus package that we're just waiting to deal with right now. And that's with the government program. I'm not familiar with it enough to tell you exactly what's in it, but with the $4 trillion of aid that we're going to be getting, I hear that we're going to be able to apply for loans, that can be forgiven so that we can keep our staff fully employed. But that's something that you need to look into yourself. Go online. There's tons of information on the web right now. Talk to your accountants. They'll be able to fill you in on that. But stay proactive and stay informed.
That's great. Great advice. So, we work with a lot of the dental schools, and we had Dr. Jean Andrea on yesterday. And what advice would you give the students who are looking for jobs, or the young dentists who are sitting there going, "Holy cow, I just started." What would you want to tell them directly and our listeners?
Are you speaking about the dental students or the people that are just graduating from school?
Both.
Yes. Okay.
I mean, talk about from the voice of wisdom, having been. I mean, you've been practicing 50 years. What would you want to let them know, especially now?
Here's probably the number one lesson that I can give any new student graduating from school. My dad is 99 years old and still alive. My mom is 95 and still alive, and they're both in great health. My dad was a coach. So any of you guys that had a coach, you know what coaches are like. Boy, they sat down there. If you broke the rules, it was a tennis shoe on your backside. I got it a few times. So
only a few.
Yeah, you too. What my dad told me was this. He said, "Tom, this is really important. It's going to be probably the most important thing that I'm ever going to tell you. You need to take 10% of your income and you need to save it." And that's all he told me. But what he didn't tell me was the power of compound interest, of compounding your investment. I didn't know that, and it took me a long time to understand that. So I tell my kids this. You've got to save. You've got to plan for your future. You've got to have an emergency fund. You need an emergency fund. Right now, we're in an emergency. And if you don't have an emergency fund, or you didn't have an emergency fund, you're scrambling right now. Luckily, I had a little bit of an emergency fund that I have been going through to pay my rent, to do all stuff, because I'm basically down to zero income in the office right now. And so I do need that emergency fund. But above and beyond that, you need to plan for your retirement. So whatever you're making, whether it's $100 a week or $1,000 a week or $10 a week, put a little bit aside. Find a good investment planner, a good fiduciary person that can give you investment advice. That's not going to be me. I'm not going to give you the investment advice because I just don't know. I'm not that smart. But there's a lot of great opportunities. So that's number one. Plan for your future, plan for your retirement, even at this young age, even when you're only 20 or 25 or 30, whatever that happens to be. Then number two, watch your overhead when you go into a business. If you possibly can, buy a business. Try to be your own boss. Try to own your own building.
Even in this time of crisis.
Even in this time crisis, especially this time crisis, the last thing that you want to do, even though I'm doing it, I have to pay rent here because I don't own the building that I'm in right now. I pay rent. But boy, I sure wish I would have bought it when it was available so many years ago, because then this wouldn't be such a crisis for me.
So, well, very much.
Well, let's continue down this road a little bit. When you're practicing dentistry, practice a quality dentistry. Do the very best that you can do. Give your patients the very best care with the top quality that you possibly can. Don't say, "Oh, this is good enough," because when you go back and say this is good enough, it's going to fail someday, sooner rather than later. So do your very best. Use good materials, get good equipment. Always strive for the best that you can be.
So it sounds like even in crisis, there's the other side. And what's really important, especially to younger dentists, is that you want to get through, based on the advice you gave earlier on about, talk to your vendors, talk to the people that you owe money to and all that, but also don't lose sight of what you need to do when we finally get to the other side of this.
Yeah, we'll get to the other side. I mean, it's a matter of time. Things will be different once we get there, but we'll adjust and we'll accommodate and we'll move forward. We're going to fight one battle at a time, and we'll move forward. This is a battle. We're in a war right now. We are absolutely in a war with the coronavirus. We'll win. We'll probably win in a shorter time rather than a longer time. this doesn't look like it's going to take the great amount of time that HIV and AIDS took back in the 80s, which we still haven't. All we've managed to do right now is slow it down. We haven't conquered it. So I'm sure we'll conquer this virus just like we have colds and flus and measles and mumps. You know, they're just viruses, and, you know, we take this virus and we'll beat it.
That is awesome. Dr. Hirsch, thank you so much for sharing what you're doing in your practice, for sharing how you're treating your patients, dealing with the emergencies, and the advice on how to kind of get through this. It's been, you know, it's a pleasure working with you. It's a pleasure knowing you. I really appreciate the fact that, you know, you continue to do this, and your love for dentistry is amazing. So any final last words?
Yeah, I do. I have a couple of final last words. Thanks for asking, Ro. So here's my final last words. Eat right, stay healthy, work out. You don't have to go to a gym to work out. You can work out right in your own home with push-ups and jumping jacks. You can run around the block. You don't have to spend money to work out. So work out, stay healthy, eat right, wash your hands, wash your hands, wash your hands. Your social distancing, yeah, keep a little bit of distance from people. People are coughing and sneezing and this and that. Yeah, stay away from them. So stay safe, stay clean, eat well, mind, body, soul, religion. Do all the right things, and we'll get through it.
Thank you so much. Appreciate it. We'll have you back again a little bit later, and so you can share some more of your insights. But have a wonderful rest of your week, and thank you for taking the time to talk with us. It doesn't look like we have any questions. So. Pardon?
Thank you. Oh.
All right. Thank you.